Hi everybody, it's Jamie from Learn MSK Sano. Today I'm going to do a scanning demonstration on the lateral compartment of the knee. I want to show you the difference between scanning the lateral collateral ligament and the biceps femoris tendon, which both insert onto the fibula. Okay, let's get started. Okay, now I'm going to demonstrate how to scan the lateral side of the knee. If there was a tricky part of the knee, this is it. Only when you're scanning the lateral collateral ligament and the biceps femoris tendon, because they both insert onto the same area. The rest of the tendons in the knee are relatively easy to scan just because of their straight course. There's not a lot of anatomy to memorize, but the technique is relatively simple. So I'm going to show you the one tricky part of the knee. So if you place your transducer over the lateral aspect of the knee and bring the joint line and the lateral meniscus into the center of the screen, you want to optimize the image on your system. Okay, so this is always your home base when you're scanning the lateral side of the knee, just so that you know exactly where you are. So in this picture, this is the lateral meniscus, the lateral femoral condyle of the femur, and the tibia. So the way to know that you're for sure at the fibula is to start at the tibia here, stay exactly at this angle, and move your entire probe posterior until those structures exit the screen, and then a little bit distal and posterior, you're going to see a bone by itself, which is the fibula. So both the lateral collateral ligament and the biceps femoris both insert onto the fibula. So this is why it can be a little bit tricky. So I just want to tell you how to know the difference. And I want to remind you that all ligaments connect bone to bone and tendons connect muscle to bone. So the first structure we're going to look at is the lateral collateral ligament. So you want to keep your transducer on the fibula, and then you want to take the proximal part of your probe and turn it clockwise or anterior until the ligament starts to come in. This is the ligament here. And you're going to slide your probe proximal a little bit. And then here you're going to see the femur, the proximal part of the lateral collateral ligament. This is it here, and you want to tweak your probe just like you would when scanning a vessel, just to elongate the structure. And then this is where the LCL inserts onto the fibula. Now, one thing is you don't want to get confused with pathology when you see the biceps femoris in this area, because they do insert onto the same bone. So you don't want to confuse that for pathology. It's just because when you're focused on one structure, you can get anisotropy of another structure. So now to isolate the biceps femoris tendon, you're going to turn the proximal part of your probe posterior or turn it counterclockwise, while you keep the distal part of your probe fixed on the fibula here. So now I'm going to turn the probe posterior or counterclockwise. And now the LCL comes out of view. And the biceps femoris comes into view. So this is where the biceps femoris tendon inserts onto the fibula. And everybody's anatomy is slightly different. This patient's anatomy, it's very easy to separate the LCL and the biceps femoris, but in some people, they really insert so closely to each other that this technique is very important to tell the difference. So as you can see, the tendon inserts onto the bone right here, and if you slide proximal, the tendon becomes a muscle. So like I said, ligament connects bone to bone, and tendon connects muscle to bone. And the biceps femoris is one of the hamstring tendons, so if you can remember that, then you will remember that you have to turn your probe posterior to image it, because the hamstrings are in the back of the thigh and the knee. Okay, so I'll show you one more time. Fibula, turn the probe anterior for LCL, and posterior for biceps femoris here. Okay, and that's the trick.